My name is Kathy. I work at the Homestead Cortezes Bahardi Center, and we are getting ready to do a BBL, which is broadband light, sort of comparable to an IPL. But what we're treating today is redness, flushing of the skin, and this lovely lady, it will be her first treatment. What I'm doing now is cleaning the numbing cream, the lidocaine off, which she's had on for about a half an hour. And then once we get the skin clean, we will start our treatment. If you are curious about what the BBL will treat, the biggest thing, it will treat sun damage, age spots, pigmentation, melasma. I stay away from melasma because it can make melasma worse. With this lovely lady here, it will take probably 2 to 3 treatments because we're treating the redness, possibly a little bit of rosacea. So once I get her skin clean from the lidocaine, we will start the treatment after I get her eyes covered with the eye covers. What the BBL will treat is number 1, the pigmentation, the sun damage. It helps to treat vascular, rosacea, and it can treat some leg veins, but smaller ones, some that are red, but it doesn't treat blue. So we're going to cover her eyes. And then next, what you really need to remember to do is to apply the clear gel. The clear gel keeps the skin cool and keeps us from causing a burn on the patient's skin. So we're going to put that on full face. And the treatment after you numb can take 10-15 minutes. It's a pretty quick treatment. Afterwards, you can apply cold compresses, but I always say let some of the heat get out before you put a thick topical on. When you get home, you can apply Aquaphor, Vaseline, or if you're not real sensitive, you can apply a moisturizer and sunscreen. You will have redness 1 to 2 days, according to if you have fair skin. And if you have a lot of pigment, that pigment will get 1 to 2 times darker even before you get up off of the table and leave the office. And it will remain, it takes normally 5 to 7 days for that pigment to turn over. So what we're going to do is go ahead and start the treatment. I'm going to make sure her eye covers are on good. All right, are you ready?
Mm-hmm.
All right, we're going to start on the right side of her face, and I normally like to keep my fingers on the eye covers to make sure they're down. How does that feel between 1 and 10? 10 being the most painful.
like a 3 or 4.
Okay.
Is in the bag.
And as you're having the treatment, you can feel the heat. After we finish full face, she will feel like she's got a bad sunburn. But it doesn't last for a long period of time. And I'm just looking to make sure that she's not turning too red. And everything looks good. It's good and pink. So now we're going to move on to the chin. And normally after the treatment, you don't want to go home and start using your Retin-A tonight. You want to stay off of your Retin-A or your retinol. I say normally 5 to 7 days. And you always want to discontinue it at least 48 hours prior to having an IPL treatment. These you can receive once every 4 to 6 weeks, according to what we're treating. If you come in, if a patient has a lot of pigment, normally we'll ask the patient to start using a skin lightener 2 weeks prior to an IPL or a BBL, or really any type of laser here. And then once she heals, I'll have her to use it another 2 to 4 weeks. Still feel okay?
Mm-hmm.
Okay, let's get you to tighten your upper lip. Perfect. Okay, you can relax. Another thing that I always like to remember to tell patients, no sun exposure 2 weeks prior and 2 weeks after. Because if you come in here during the summer and you've booked for a treatment, if you've been on the beach or you've been to the tanning bed and you have had a lot of sun exposure, you're going to be more likely to have a burn, or you're not going to get maximum treatment. Put a little bit more to that. We're getting ready to do her forehead. So if you are interested, you want to come in for a consult, if you've had BBL before and you want to book a treatment, please give us a call. You can reach us at 704-659-9000, or you can email me, Kathy, at hkbsurgery.com. And even if you have questions, please call.